Olá! Começa agora o Terça Tech, Inovação em 30 minutos, um programa quinzenal da Câmara Brasil-Israel que disponibiliza acesso às mais inovadoras tecnologias israelenses. A cada episódio, 3 empresas inovadoras fazem suas apresentações em formato de elevator pitch, uma maneira dinâmica e descomplicada que cabe na agenda de todos os profissionais, investidores, estudantes e entusiastas que queiram estar à frente das tendências tecnológicas. Bem-vindo ao programa de hoje e fique por dentro das novidades do mercado tecnológico. E vocês conhecerão as empresas BrainsWay, Olive e BMT Diagnostics.
Hello, my name is Yossi Leventhal. I'm the Global Director of Sales for BrainsWay's Deep TMS device. BrainsWay is a company that's leading the market of deep transcranial magnetic stimulation with superior science, evidence, and support. What TMS is basically a technology that is able to activate neural pathways in order to create more plasticity effect to the patients in order to induce the areas that are not active during episodes of depression. TMS is a technology that's studied in multiple institutions worldwide. As you see here, we're in Johns Hopkins, McLean, UCLA, UCSD, and many, many other institutions. And we have treated over 4 million treatments, daily treatments, across the United States and every single continent in the world. But we really have to understand a little bit more about the BrainsWay technology, and then we're able to talk about what is the differentiation of BrainsWay and any other technology. So the BrainsWay system is based on 3 different coils. So we have the H1, the H7, and the H4. And we're really advancing those technologies with the ability to treat areas of the brain that are not active. So for example, with the H1, we're able to treat depression and anxiety. And the area that we're trying to treat with that coil is the dorsal left prefrontal cortex. As you see, each coil has a different design and a different pattern. The H7 is our coil that's sitting in the middle of the head, treating the OCD and anxiety and depression. And the H4 is our coil that we're treating for smoking addiction. These coils are all FDA approved, but not only FDA approved, we also have CE approval. That means that we're able to market these devices in Europe. And in Europe, we have 12 different indications that we're able to use our technology. So anywhere from Parkinson, Alzheimer, anxiety, stroke rehabilitation, and many, many other indications that are not yet FDA approved, but they are CE approved and obviously approved as well in the Israeli market. One of the new studies that BrainsWay is focusing on right now is PTSD. With unfortunately the situation that's going on in Israel, we're starting to treat patients with the H1 coil for PTSD. Now, when we're talking about what is the difference in between the deep TMS, the BrainsWay technology, versus any other technology in the market, is that we are able, with using the same amount of stimulation, we're able to activate deeper structures of the brain, but not only the ability to activate deeper structures of the brain, we're also able to do it broader. And the reason that broad is very, very important is because you're activating those regions of depression, you're activating the regions of anxiety, the regions of OCD, the regions of PTSD, and therefore you're able to cause better plasticity effect and better long-lasting effects. And when we're looking at the color, what I like to say the color within the brain is you're able to see here the differentiation. So again, using the same amount of stimulation, the same amount of power, the BrainsWay device here on top is able to cause a lot more stimulation than the standard TMS device or the figure 8 coil. And you're able to see the difference in the red here. So when we're talking about depression, for example, we're trying to treat anywhere from 4 to 6 centimeters within the brain, beneath the dura. And with a figure eight coil, you're able to see that that is, again, our competition. You're able to see that there's hardly no stimulation happening. And with the BrainsWay device, we're able to still see activation and therefore the plasticity effect. And here you're able to see the differentiation basically in the power. So both devices are starting at the same amount of power. And with the figure eight coil, the standard TMS, you're losing power very fast. With the H1 coil in this case, you're losing power very, very slow, and therefore able to activate those neural pathways. In OCD, the same thing with a different design coil. Again, it also has another coil that is competing against the BrainsWay device. We have the DB80, and here you're able to see the same thing. OCD, it is a deeper structures, and therefore you have to activate deeper areas of the brain. But again, the idea is that we're able to activate deeper and broader stimulations. I'll skip this part, but as I said, the colors are important, but also the science is important and the results are important. So the deep TMS technology is able to bring 6 out of 10 patients to active remission, meaning no more depression, no side effect, very safe technology versus medications, obviously, versus the competition that the figure eight coils and obviously BrainsWay in all response and remission have better results. So to summarize, BrainsWay not only has better science, better response, better remission, we're also able to help your customers or the customers of Brazil with different models of helping them with the financing of the device. We have different business models, for example, leasing, buying the equipment. We really partner with our doctors, with the end users, with the hospitals in order to make sure that they're able to grow their business. So we help them with understanding the clinical side, the business side, the reimbursement side of working with the government to get reimbursed. And we have a platform technology. One device is able to treat, as I said, depression, OCD, anxiety, Alzheimer, Parkinson, and many, many other indications. And we really have a very big advantage against any other technology in the market. With our device, you have better science, better response, better remission, and very good business opportunities with our technology. Again, thank you very much for listening to our piece and looking forward to speaking with you soon.
Hello everyone, and thank you for inviting me today. I would like to present to you Olive Diagnostics, which is a real-time accurate insight into a person's health for prevention, cure, care, and nutrition and longevity. Basically, this is a movie that was done in Hollywood a few years ago about the future, and let's say the whole story of Olive in a few seconds. What you can see here is basically the idea of Olive in general. The idea of Olive in general is that urine uniquely offers biomarkers non-invasively, passively, and continuously, and this can now be detected using spectroscopy. First, I would like to present the team members of Olive. I am the CEO with a lot of experience in the past in running companies into public, into sales into Pfizer and Johnson & Johnson and Teva. Yaron is our Executive VP of R&D. Ofer is our Chief Science Officer. Yaniv is the head of spectroscopy and Chief Technology Officer, and Mirit is the head of Clinical Affairs. The whole idea of Olive is that sustainable healthcare is expensive due to a limited personal monitoring options. However, early detection is the game changer in saving lives and money. And the key in prevention and reduction in spend is actually in accurate diagnostics and on time before symptoms are occur. And urine is the key. Apparently, in urine, there are 95% water, but 5% data gold mine. Apparently, once we are able to detect modules like proteins, hormones, we immediately can tell you what is the field of medicine, diabetes, or female healthcare, for example, and what is the application. Can we use it for chronic disease management, for pregnancy, UTI? If it's other, like red blood cells or white blood cells, it actually real-time alerts for early detection, long-term, for prevention healthcare of many diseases and conditions. So what is the idea of Olive device? Basically, we have a LED in a LED source, and we have here, as you can see, photodiodes. Basically, using spectroscopy, we can actually cover the whole area of the bowl of the toilet seat, and basically, non-invasively, we can diagnose the disease that there is. Let me show you a quick movie how it's work. Basically, as you can see, we have one side source of light. On the other side, we have a source of photodiodes. Everything is sent out in Bluetooth and Wi-Fi to the cloud. And once a person pee, we can immediately detect exactly what it is. So basically, Olive Diagnostics solution runs on its groundbreaking 100% pure optic urinalysis that mounts to any toilet. AI performs urinalysis from data that the device collects in real time as the person urinates anywhere and anyway into the toilet. The device enables two types of analysis. The first is urine molecular composition analysis with actual molecules such as albumin in the urine. The second is urine physical characteristics analysis such as volume, color, duration, and frequency. So what you can see here is an example of a toilet in a medical hospital, actually in Asuta in Israel. This is how the device looks like. And basically, once a person goes and pees, all the information is sent by Bluetooth and Wi-Fi to the hospital elderly care. Basically, the end user is going to the pee, the data are collected, sent to the cloud, and from the cloud, the modules are sent back to the doctor, to the patient, and to anyone else that we are looking for, a healthcare provider. The company is using Galen Cloud. Everything is based on AI, and from measurement to measurement, the accuracy is increased. So what can detect today? As of today, we can detect all of this. We can detect protein, specific gravity, pH, volume over time, color, and frequency. All of these are actually detecting diseases like kidney disease, some proteinuria, and some other diseases of the elderly. In the future, very soon future, we can detect other modules like white blood cells, nitrite, cortisol, alcohol, etc. The competitive landscape is putting Olive in a very special place because Olive is the only one that is using spectroscopy, is the most accurate. All the other technologies that are known of today are using chemistry-based stick, which have an inherent accuracy of up to 70%, which means that once you are going to the lab or going to do some measurement on stick, 50% chances is that you will get the wrong answer and there is no real idea what's going on. The other problem is that you are limited to the number of molecules you can detect. With olive, it's not only chemistry, it's spectroscopy, so we can see any molecules, we can increase the number of molecules over time, and we can look into other information. This information is securely sent into the cloud and give us a profile that in real time. This is a case study that shows that olive solution is cheaper than urine stick, and over time, during 1 year, you can see that even in the first year when you still need to pay for installation of a toilet, it's still cheaper than sending a nurse 12 times to an elderly home or to assisted living, and in the future, each year will be only $240 cost, which is basically only the cost for subscription price per month for using the toilet and get 24/7 data. What we are going to start with is the elderly care, assisted living, and home care, when we can detect UTI, kidney stones, heart failure, hydration, constipation, starvation, electrolyte imbalance, all by the indication that are listed here, and I show you that we can measure in accuracy of up to 90%, and with time and with data collection and AI, the accuracy will increase up to 100%. So at the end of the day, if you are the first time user, we will actually collect the data, and since then we will have a very specific urine fingerprint that is specific to your data. However, if this is the first time, you will come into your home or to a place when you have a place where you can choose your identification. The data are sent to the cloud. From the cloud, they are sending back to your smartwatch, to your phone, and from then on, the toilet will know to recognize you every time you are going to pee. So we have a wide range of market applications. We are going to start with assisted living, home care, and telemedicine, but in very short later on, we will go into safety at work, mental health, vitamin balance, feminine health, fitness tracking, law enforcement, and social health, etc. If we are looking into where is the company going to in the next 3 years, you can see that in 2024, we are going to look into assisted living, and basically by the end of the year, we are going to produce our first 100 units. Next year, we are going to target additional labs and HMO, hospitals, and insurance companies. We can go up to 20,000 units per year, and in the future, we will go into additional biomarkers like hormone, and in 2027, even to inert molecules. The idea that at the end of the day, urine can replace almost 90% of all blood tests, and it will be 24/7 and will give you much more information and much more accurate. The business model is basically have a device that can be sold, but in the future we would like to be a white label. We would like that every toilet will have olive that is in it, and it will be operated by olive. So like you have Intel inside, from now on you will have olive inside in your toilet, and you can detect your health and wellness every day, 24/7, and basically prevent the diseases even before the symptoms show up. The company is in Modi'in. It has so far invested $10 million to date, 7.5 from investors like Health Ventures, Amgen, Venturing, and Maccabi Fund. 2.5 million were granted from the Israel Innovation Authority. The company has 4 patents, 25 employees. We are already CE certified and MOH certified. And we are really right now in the clinical studies in progress for port marketing in order to get an FDA approval in the very near future. So thank you very much, and will be more than happy to share more data and more information about Olive for whoever is going to ask. Thank you.
Hi everyone, my name is Dr. Idan Tamir. I'm the CTO and co-owner of BMT Diagnostics, and I'm going to talk today about our platform technology. One of our platform technology is called Lab on Time. It's depicted here. It's a rapid diagnostic testing platform that allows intelligent, convenient, and elegant testing of swab samples. So a little bit about us. We are a rapid diagnostic testing developer and manufacturer since 2008. We're ISO 13485 certified. We have clean room manufacturing space, several automated manufacturing lines, which I will show you, and over 300 products. Multiple products are CE marked. So the vision of BMT Diagnostics is to provide smart, innovative, and convenient rapid diagnostic testing solutions, especially for point of care and also for self-testing, which has become much more prominent since the COVID-19 pandemic. So this is a family business. My wife, basically myself, own the company. My wife, Neely Tamir, is the CEO, and I'm the CTO. Neely's background is in microbiology and immunology. I share a similar background. I did my PhD at the Weizmann Institute, spent some years in the US, and then since coming back to Israel, I've headed multiple startups in both the medical device and diagnostic space. So what is the unmet need that we are addressing? So typically for rapid diagnostic tests, they are usually conducted in laboratory settings upon following patient consultations. They are usually quite challenging to execute, require reading an IFU and instructions for use before using them, and they demand significant time and focus, not very intuitive, and quite operator dependent, also in terms of their accuracy. So our solution is the first patented platform that allows no-step, convenient, and accurate rapid diagnostic test performance. And I'll show you in some slides how this operates. So this proprietary innovative platform is addressing multiple swab-based rapid diagnostic indications. We have it CE marked and TGA approved for strep A. It has over 97% sensitivity and 99% specificity. Also for influenza A and B, it's CE marked, again, with similar sensitivity and specificity, and also for COVID-19 antigen. There are patents granted for this platform in the US, EU, Japan, China, Israel, and more, and several continuation applications. These tests have been clinically validated in Israel and in other territories for both their usability and accuracy. And we're developing other tests on this platform for RSV and combo tests, including influenza, COVID-19, and other antigens. So this is our US patent, which covers this whole family of tests. So these swab-based tests, our key advantages are that this platform improves the process of patient screening. It shifts patient screening from centralized labs to point of care. It improves general health and the HMO service. It saves time and money for both patient and HMO. It's a proprietary swab that allows improved sample collection and higher pathogen recovery. And no step operation, you'll see in a minute. Improved usability, results are available during an inpatient visit. It has enhanced accuracy, and there's minimal fluid or liquid and plastic waste disposal. I'll show you two movies. So this is the nasal, and this is the nasal application. As you can see, it's very simple. The rapid test works in a way that you take the pen out of the package, then you take a sample, a nasal swab. It fits the nasal of the nasal of both kids and adults. And then basically the device is placed in a tube which is provided. And then the results are seen on the device. You don't have to dispense any liquid. You don't have to move it to any other place. The results, within 5 to 10 minutes, you get the results on the device itself. For the throat swab, it's a little bit different, but only in terms of the sample collection. So again, very suitable for kids. The long stem of the device allows access to the back of the throat, the nasopharyngeal, the back of your throat. It allows to collect samples, bacterial samples from plaques in the throat, and the rest of it is very much the same. So in terms of our capacity, so we have a manufacturing facility. Everything operates in a clean room. This is the assembly station, and we have the same or similar system for food manufacturing. Everything is automatic, and we have a capacity of over 5 million tests production per year. The next slide shows one of our clean room facilities, and then again, the way that these devices are entered or are removed out of the manufacturing, out of the machine and into the packaging space. So in Israel, we have a very strong and diversified customer base. We sell to all HMOs, all of the pharmacies, both the big chains, Superpharm and BE, and also to multiple private pharmacies, private clinics, medical centers. We're selling to the Ministry of Defense and the police. And basically what we're looking forward to is expanding our sales globally. We have multiple CE-marked products we're selling in Europe. We have sales in Australia. We have TGA approval for the Strep A device, and we're in the process of a USA 510K submission. And we're looking for global strategic partners and distributors in additional territories. And we believe Brazil is a huge opportunity for us. So we will be very happy to hear from you. And many thanks for your attention.